Who wants to talk about end-of-life care? I'm not going to do that right now. Alrighty. So, hello. Thank you very much, Dr. McKenzie, for your tutelage over the last 3 years and supporting my ambition. So this is the mouthful of a title known as Just in Case, Evaluating Nursing Students' Knowledge, Attitudes, and Self-Efficacy Towards Care for the Dying Patient. I'm just going to refer to it as Just in Case. Just a little personal background, that's my mom. And she's right there. And we went to Phoenix, as Dr. McKenzie spoke about, with the help of KERF. I would not be here talking to you today. So this started 3 years ago. We did the independent research option, Meredith McKenzie and I. I was a recipient of the VERF grant in 2016. I then went to the Grand Canyon, and I went there for the first time, and it was 17 degrees, and it was wonderful. And then it was accepted into the Journal of Hospice and Palliative Nursing. I am also now a Falvey Scholar, and research is an amazing experience, but I don't have to tell any of you that. So just a disclosure, this project was funded by VERF over the summer. So a little bit of background. Nursing students will encounter death and dying in their pre- and postgraduate professional life, and they must be prepared to provide quality care to these patients while maintaining their own emotional health, which leads us to burnout. Burnout is emotional exhaustion, a lack of personal accomplishment, and depersonalization that affect all nurses, their patients, and their patients' families. While multiple studies have examined innovative ways to incorporate end-of-life concepts into the curriculum, little is known about the current student nurse knowledge, attitude, and self-efficacy around care at the end of life. A little bit more background has the literature showing that knowledge of providing end-of-life care and its processes has shown a direct correlation to patient outcomes and the ability to provide accurate and holistic care. Attitudes towards end-of-life care are similarly correlated, as attitudes have dictated whether a student nurse experiences distress during this time or steps into the role and provides patient care wholeheartedly. Finally, self-efficacy, or the belief in one's ability of student nurses, is the deciding factor as to what degree of attention and detail orientation that they provide, or subsequent burnout and emotional distress. Obviously, we don't want that. So the aims of this study are as shown. This study was quantitative and it was comparative, and it included sophomore, junior, and nursing students' knowledge, attitudes, and self-efficacy around caring for the dying patient. We didn't ask freshmen because that would just be mean. We measured and examined correlation. So just an overview of the procedures and measures. We did recruit sophomores, juniors, and senior level nursing students in the traditional 4-year Bachelor of Science in Nursing program, or BSN. The recruitment email was sent out containing a link to the survey from class lists obtained from the administration. A reminder email was sent out once weekly for 6 weeks, and participants were offered an incentive in the form of a $5 Starbucks gift card. We measured knowledge with the knowledge instrument, which was a 7-item questionnaire that measured the knowledge of the physiological processes of dying. We measured attitudes with the FAT-COD, a 30-item 5-point Likert scale questionnaire that measured the student nurse's attitudes toward caring for the dying patient and the dying patient's family. Finally, we measured self-efficacy with the self-efficacy assessment, very aptly named, an 8-item 6-point Likert scale questionnaire which rated the participants' self-efficacy or confidence related to providing professional care, emotional reaction, and physiological knowledge. So our demographics were decently homogeneous. Nursing is a very Caucasian career, and as you can see, it was 87% of our population. The average participant was a 21-year-old female who identified as Christian and considered herself spiritual. Ironically enough, spirituality and religion did not affect any of the variables that we looked into. So, some results. The data collected in subsequent analysis showed that the only significant correlate on students' knowledge was their class year. Unsurprisingly, seniors had a higher knowledge score compared to their underclassmen counterparts, most likely due to their increased exposure from information in lecture. Basically, they attended class. The numbers shown show out of how many questions did they get right. So as you can see, sophomores got 5 out of 10 questions right. Juniors got 5 also out of 10 questions right, but a little bit more. And then our seniors got 64%, so about 6 out of the 10 questions right. For attitude, significant correlates towards caring for the dying patient included their ethnicity, their past experience in caring for a dying patient, and their age paired with their confidence. So, students who are identified as non-Caucasian actually held less positive attitudes towards providing care for the dying patient on average compared to their Caucasian counterparts. Students who had not cared for a dying patient had, also on average, less positive attitudes than those who did, perhaps due to misconceptions or discomfort. Students who had not cared for a dying patient, as I just said, discomfort, and the interaction between age and self-efficacy was significant, suggesting that the older you are and the more confident you are in yourself, you're going to feel more positively about providing that care. Finally, the results for self-efficacy showed significant correlates, including class year and students' attitudes. Upperclassmen had a higher self-efficacy than underclassmen, and those with more positive attitudes scored higher on self-efficacy. So once again, as you can see, they are more confident in their ability once they grow up and they experience more education. So we did have a handful of limitations. The sample, like I said before, was mostly homogeneous. They were Caucasian females. Additionally, the study only included traditional 4-year BSN students, which limited the sample size and the demographic data. We did distribute the survey at the end of the spring semester and the beginning of the summer, which definitely limited our response rate as many students had already left for summer break or graduated. We recognize that high scores on the measured variables may not actually translate into effective end-of-life patient care. Student emotional availability and communication with families has been shown in the literature to be more problematic than their ability to provide physical care. We were not able to measure these characteristics in their study. Basically, what it looks like on paper isn't always what it looks like in practice. In conclusion, class year positively impacted knowledge and self-efficacy, but did not affect student nurse attitudes towards end-of-life care. This finding does suggest that current nursing education may be missing an effective component, such as identifying barriers towards positive attitudes or offering sufficient experiences in this field. Students who identified as non-white and those without experience in caring for the dying patient had less positive attitudes. Clinical exposure to end-of-life care, such as hospice and palliative care experiences, may promote more positive attitudes. More research is needed on the attitudes of students of color towards end-of-life care. While racial and ethnic disparities in end-of-life care have been well documented in the literature, there is little comparative literature on how nurse race or ethnicity impacts their attitudes towards providing this care. Increased exposure to end-of-life concepts in the curriculum, whether via integration of the LNEC, which is the End-of-Life Consortium, curriculum, or via a class devoted to end-of-life care, have been shown to improve student attitudes. Further research should examine the impact of race and ethnicity on student attitudes towards end-of-life care in larger and more racially diverse samples. So the next steps for CON, or the College of Nursing here at Villanova's campus. Ultimately, Villanova's College of Nursing could utilize this research information and optimize end-of-life education. With this data, CON could identify barriers and construct methods to approach this data more thoroughly. This could be done through introducing these concepts earlier in the curriculum. Additionally, a possible senior seminar at the for end-of-life care could be offered for students who are more interested in the topic. Simulation days in the lab would also be beneficial, as like most skills, it is much better to establish foundational knowledge in a controlled environment than on a real patient. Future research for this data. honestly, examining students' emotional availability and communication with families has been shown in literature to be more problematic than their ability to provide physical care. That being said, this is a process that would be very qualitative. This is something that you would have to sit down and talk to somebody and really get to know how they're feeling and why they're coming from where they're coming from. Also, psychometrics, which is looking at the tools that we utilized and seeing if what the tools that we utilized were actually the best tools to be used, even though they did produce statistically significant data. Maybe it's time for some new tools to be used. Here's a list of the references that I used, and just this. And thank you very much for your time. Any questions, comments, or concerns? Cool.
Okay. So then, on behalf of the library and the Center for Undergraduate Research and Fellowships, I congratulate you and present you with your Falvey Scholar Award.
Thank you very much.
You're very welcome.